Exclusively for Hampton Roads, Cox Communications presents Cox Business Television.
Welcome back to CBTV. I'm Mike Brown. In our last segment, we heard about healthcare reform from a small business point of view. But what about providers? Back with us from our first segment is Dr. Margaret Gaglionne, who, as we discussed, is not only the founder of a small business, but is also a physician. And joining us now, Dr. James Dudley, chairman of the board of Riverside Medical Group, as well as an emergency physician at Riverside Tappahannock Hospital. Dr. Dudley, as a doctor, what are some of the concerns that you have, or what are some of the optimistic things that you're seeing as we're talking through healthcare reform?
Well, I think what I'm most encouraged by is the fact that this issue is on the table, that our leaders have stepped up and embraced the discussion, because this is a critical issue and now is, in fact, the time to deal with it. What I'm concerned about is that perhaps those leaders will lose sight of the fact that at the heart of this issue is the problem with insuring people. We have too many uninsured citizens, and the problems of cost of small businesses, large businesses.
Okay. And in fact, some of the things that we heard about on the panel was that there's actually cost down to the individual. And one of the panelists commented that there's a personal accountability also for us to look at this. And both as an employers and employees, Dr. Gaglionne, in your practice, you're really helping people make these changes every day. Personal accountability.
Really, our practice is built on that. We help people lose weight. We have treated 464 patients in the last 2.5 years, and they've lost over 16,000 pounds in that period of time. Personal accountability is the foremost thing that they have to do. It's not a diet, it's a lifestyle change, and we emphasize that from the very get-go, that this is not a temporary thing. We have to really change what we're doing and recognize that the poor food choices that we're making have led to obesity. And I think by showing people that they can lose weight and they can be full and they can make effective choices, recognizes the difference between eating right and eating poorly, and those differences.
And Dr. Dudley, you may even see some of these patients on the other side from your emergency room practice. If in fact they're not taking care of themselves, there is an impact. And we heard also on the panel that in the state of Virginia, everyone gets health care. If they come into emergency rooms. You commented on that the other day.
That's true. There's a federal law called EMTALA, E-M-T-A-L-A, and it requires that every participating emergency department see and stabilize whatever comes through their doors. And unfortunately, there's no connection between the visit and necessarily the reimbursement or the cost of that visit.
And the insurance does play a part here, because in your practice, or we're really understanding is that wellness sometimes, but obesity specifically isn't covered on a lot of these insurance practices.
And majority are not covered. For patients that want to lose weight and learn education to do it, and it really does take education and support, particularly if patients have diabetes or hypertension or comorbidities from their obesity, they need the direction of a physician. And these things are not covered. So we have to begin to look at programs that will, or insurances that will be proactive in helping patients that want to lose weight and decrease their insurance costs. And that's what we're really working with different insurances to begin to look at our data over the last 2.5 years and see what we have done.
Okay. And are we seeing with the healthcare reform, is there been like equal distribution around the reform that might come to a rural population as well as the urban populations? Both are suffering from whether it be obesity or many other things, but oftentimes we're hearing that the care or the understanding of as an individual citizen might not have all the information in some of the different areas.
That's true. There's a big difference between rural and urban other than population density. Some of the current systems pay urban providers, hospitals in cities or suburban areas get paid more than hospitals in rural area for the same diagnosis. There are programs by the government that actually recognize this discrepancy, and so small hospitals in the country get a special payment because of that sometimes. But there are also educational issues with respect to patients. They may not understand as much as far as accessing the internet or coming to the physician with the information and the questions to ask. So we've got a huge gap in healthcare literacy that needs to be closed in order to solve these issues.
That's neat. Well, I mean, it sounds like, in some of the conversations that a more well-informed employee, both for how they do their lifestyle, but also access to information might be one of these keys going forward, and that might be something which as business leaders we can also help with.
Absolutely.
Thank you all for your service to our community. Thank you for all that you mean to your patients and to our families, and we thank you for being with me here today.
Thank you for having me.
There's still more to come on CBTV. Up next, the role of technology in reducing healthcare costs.